from the
Right. You want to get us started, Emily?
Yeah, let's go ahead. It's 5:31 over here. I'll just introduce myself. Hi, I'm Emily Cole. I'm a third-year veterinary student over here at Washington State University. I'm the co-president of our Voice chapter over here. So that stands for Vets for One Inclusive Community for Empowerment. So that's kind of our goal here. And we've done an amazing collab with our panelists here from the Multicultural Veterinary Medical Association. I just wanted to make a quick announcement for those of us joining from Voice, from WSU. If you send a screenshot of this Zoom that you attended to voice.wsu@gmail, we'll enter you to get a DoorDash gift card, so dinner's on us. And I just wanted to say thank you for everyone for joining us today. And without further ado, I'll introduce thanks, Jennifer. And then I'll introduce Dr. Sohaila Jafarian. She completed her DVM and Masters of Public Health at Kansas State University in 2018. After graduation, she went on to a rotating internship at BCA in Albuquerque, New Mexico. So a little bit of travel there. And then she gained valuable clinical experience working in a state with a long history of colonialism, broken promises, and racial and socioeconomic inequality. Then she had the opportunity at University of Pennsylvania as a community medicine intern. And not only was that an invaluable experience to her, but it was great to see the positive impact of the veterinary community in action, but also introduced Dr. Jafarian to the field of veterinary social work as another valuable avenue to improve collective human and animal welfare. She recently returned to New Mexico and is working as a relief veterinarian, but beyond her clinical work, she's collaborating with the University of New Mexico's College of Public Health, working on incorporating One Health topics into their program. So that's pretty neat. She's also a member of the Association of Shelter Veterinarians, Diversity, Equity, Inclusion Task Force, and the Continuing Education Chair for the Multicultural Veterinary Medical Association. So a lot of abbreviations there, but I'm very glad to have her. And if you want to go ahead, take it away.
Thank you so much, Emily, and thank you for getting this conversation started. Everyone, this blew up way bigger than we expected it to, and we ended up opening it past students. So we're really excited to have this conversation and see everyone here. I will say we are breaching some really big topics. So I'm just going to jump right in and get started because I have a feeling we're going to have a hard time squeezing all of this into an hour. So as everyone knows, there has been a really profound shift in veterinary medicine, which has led to efforts to increase DEI and discussions on the detrimental impacts of the lack of DEI within the profession. However, how has this lack of DEI impacted communities we serve or we are not serving? How has animal sheltering played a role in systemic racism? Like I said, the students at Washington State reached out to us and invited us to take a deep dive onto these topics and what the future holds for shelter medicine. Please note that this is a foundational conversation, and please consider filling out our post-event survey so we can know where to focus future conversations. So I'm going to introduce our panelists. I'm going to start with Dr. Jesse Navatta. He graduated from Cornell University in 2017. While in school, his focus moved from wildlife conservation to shelter and community medicine with a special interest in DEI in veterinary medicine. In 2016, he completed Purdue University certificate program for diversity and inclusion in veterinary medicine. Taking many opportunities to reach underserved populations, Jesse has worked abroad in countries including Bulgaria, Mexico, and Brazil. After graduation, he continued to pursue his passion by working with community members on the south side of Chicago, in addition to teaching HQHV to Cornell students abroad through the FAR Vets program. He currently works for the Treehouse Humane Society in Chicago, Illinois, serves as a mentor for Pride VNC through the Possibilities Network, and is a member of ASV's DEI task force as well. Dr. Rachel Wooten completed her DVM at Tuskegee University in 2017. While in veterinary school, her passion to help underrepresented communities grew, and she decided to pursue a career in shelter medicine and became particularly interested in soft tissue surgery. Following graduation, she moved back to Illinois to complete a one-year specialty internship at University of Illinois in shelter medicine. Through this internship, she found a new passion in teaching and community medicine. In 2018, she finally made it back to Chicago to practice shelter medicine, focusing on high-volume spay-neuter and community outreach. She is now a full-time veterinarian at One Tail at a Time in Chicago, focusing on growing the clinic and expanding the organization's community outreach impact. Professionally, Dr. Wooten serves on the DEI committee for Association of Shelter Veterinarians as well, and is a member of the advisory board for Black DVM Network. And last but certainly not least, Dr. Jyothi Robertson is a boarded shelter medicine consultant who has been consulting for the past 15 years internationally as JVR Shelter Strategies and AdAsia. She was medical director for Oakland Animal Services and currently works with her local animal control facility. Jyothi is on the DEI committee, executive and management committees for the Human Animal Support Services. She is chair to the National Animal Welfare Committee for the American Veterinary Medical Association. She served on the executive board of the Association of Shelter Veterinarians as treasurer for 6 years and is currently on their DEI task force. She has held 6 other board positions nationally and works on social justice issues through her platform, The Journey on Your Own. Thank you all so much for being here. We are really excited for this, and let's jump right in. And I'm going to jump right in with the broadest question. Are there underlying assumptions or bias present in sheltering practices? Very loaded for this question.
Start. Maybe I'll start. This is supposed to be pretty casual. Thank you for that introduction, Sohaila. And so I am very pleased to be here with you, Jesse and Rachel, to start this conversation off. And you're right to say that is probably the broadest question that you could have asked, which is, is there systemic bias? Is there, does bias and assumption play a role in sheltering? And if you think of bias as being something that's inherent in all of us in the work that we do, and if we start to examine our own bias, then obviously, yes, it is, and it plays a role in the structures that shelters were built around. I'm sorry, I'm hearing myself echoing. Are other people hearing that as well? Yes. No. Okay. I'm getting both a yes and no. So maybe Rachel, can you start talking, please, so I can tell if it's me?
Yeah. So I definitely am agreeing with you. I mean, it's a very broad question and everything. And I mean, ideally, I think we all know, like, yes, there are implicit biases in shelter medicine. I mean, in, everyday life, we're seeing this. So, I mean, specifically something that I've, noticed when I first joined in, and like, even talking about like maybe like adoptions and things like that, we put a lot of restrictions on maybe like who can adopt these animals. And we have to look into ourselves and say, why are we putting these restrictions? Like, what makes a good home for an animal? And who are we to say, like, we know exactly what makes a good home? So things that we might want to look at are looking into our actual adoption processes and things like that, to see like, where are we really going with this? We can't say who is going to be a good home, even if we get the perfect applicant. Say, how do you know what's going to happen once they leave us in our facility? We don't know. And that's the big question. That's what we have to try to unlearn, all these biases that we do have, considering what we have been doing might not be the best practices so far.
I love that you just used the word unlearn. I'd like to sort of unpack that word unlearn, because when I think about unlearning, we are conditioned, we have thoughts, beliefs, ideas in our lives which stem from some sort of origin, right? Like we were taught by teachers in vet schools, growing up from childhood, from parents, from friends. And we've based our ideas about sheltering and veterinary medicine on what we've learned. And some of this really takes that unlearning process to really examine, why is it we're doing what we're doing in sheltering, right? Like, why do we practice? Why do we have those adoptions processes that you were just referring to, Rachel? And what are the origins of those? And does it go back hundreds of years to systemic structures that were created that actually impacted the creation of those processes, and now we're just so used to it that we're sitting with that? And what does it take to relearn some of that? Jesse, I think I might have just cut you off, so.
Oh, no, you did not. No worries at all. I know there's, I don't know if I have anything more to add to that at this point, because in this stance, because you guys are amazing, of course, and have really addressed that. But truly, I have no doubt. I don't believe there's any question that it does go back very far, centuries of these unconscious bias that we all have, that we've all grown up with, and everyone is different with how you've grown up. But the shelter practicing, just like shelter practices, just like Dr. Wooten was saying, or Rachel was saying, it's totally present. I really have nothing else to add.
You know what, I have one idea that I was just thinking about as far as veterinary students. You might not be as familiar with something called Project Implicit, which comes out of Harvard University. Thank you, Dr. Bolser just put it into the chat. Harvard's Implicit Bias partnered with CARE, which is Companions and Animals for Reform and Equity, to create a very specific animal welfare bias test. But in addition, there are many other tests that you can take which examine your own implicit bias. And I found it to be fascinating because, we all walk in saying, well, I don't have any bias, or I'm not biased towards this or that. And there's about like 10, 15 different tests that you can take there that really are pretty eye-opening when you do that. And so for those of you who maybe are not familiar with it, I would encourage you to think about that in the context of, again, bias in sheltering or in veterinary medicine. And then Rachel, you mentioned adoptions processes, and
yeah, because when I first came during my internship at Illinois, we went to a bunch of different shelters, and we would travel with our mobile unit. And I always would talk and see oh, how are you running your rescue, or how is this working? And it was very interesting to see. For instance, one story I have that's when I really realized, I was like, wow, we have a lot of barriers for adoption. One of the other rotating interns, he wanted to adopt a puppy. So I was like, oh, perfect. I can, this is easy. And so I put him in touch with, I was like, what do you want? Looked around. I got to see a bunch of different ones. And I had him fill out this application at one of the shelters. And their process, even for him, they were like, do you have a backyard? Do you have, how long are you at home? How long are you doing this? And it was just he was just I'm not, are they not going to accept me? And because I don't have a backyard right now, I'm living in an apartment. And this, he's a veterinarian at this point. So you would think yes, we would want a veterinarian to adopt animals per se, but it's little things like that I'm like, okay, why do we only think that a person with a backyard or who's home, I don't know, now everyone's home, so that's a different story, but who's home for a majority amount of time is able to adopt a dog and provide a dog a good home. Maybe they're very active and they're going to go on runs all the time, but someone who isn't, I could have a backyard and I won't take my dog on a walk for days. It's just a very interesting concept. And that's only one small thing that I could think of right now. But he even had to say, and I had to go talk to them actually, and was like, no, he's a really good guy. He's actually a veterinarian. You should pursue this adoption. And, I feel like if I wasn't there, he might have been turned away. And I think that's even just a small bias that we have that doesn't even start to affect a lot of people that we maybe want to even talk about, in our underrepresented communities that we might even be addressing now.
Right. And I think homeownership is a fantastic thing to bring up because homeownership is tied directly to systemic racism. So we have this history of redlining. We have this deep embedded history of it making it very difficult for BIPOC to purchase a home. And then that becomes a limiting factor in adoption. Could you guys speak on other limiting factors you see in adoption processes, as well as processes such as return to owner?
Definitely. I mean, one thing is always the cost of adoption, and they're different. Every shelter does have its different costs related to it, and some are obviously more expensive than others, but that is always a limiting factor, who can put down money. And then it does beg the question, when you are asking others to put forward money, are we taking money away from the pet's future, especially if people are now making the choice, well, they want to adopt a pet, but they can't even afford to adopt a pet, that doesn't seem to equate. If they can't afford the adoption fee, or the adoption fee is going to take away from their ability to provide for the pet later on.
Yeah, and then there are a lot of considerations though. Like what I think about is people will obtain pets, right? And so if they're not going to get them from the shelter, they will still get them. And so what about setting up a relationship that's a positive relationship where we can support people to have those types of positive relationships with animals? And why are we creating barriers to stop that human animal bond from happening? There have been questions in adoptions processes like, what type of pet food are you feeding? Do you already have a veterinary relationship? Do you have a fence? What are your working hours? Mm-hmm. Things like that. And all of those point to underlying fears that are unfounded, like fears and assumptions and bias. And I think really looking internally and thinking about, well, why do we do that is really important. And as veterinary students who are looking to work with shelters, going into those shelters when you're applying for a job, let's say, with a shelter, and saying, well, why do you have these practices? Like what does that serve? And really talking to people and seeing where their fears are in these conversations.
Yeah, that is a great point, Jyothi, that you bring that up. Like, we are able to challenge, when you are there, like, you have to be an advocate for everyone, right? And as you're a veterinarian in the shelter, you are in some sort of a leadership role there. So your voice does matter, even if you feel like, oh, like I might not be in every, I'm not making all these protocols, or maybe I'm not doing something like that, or like operations wise, you might not feel that way, but your voice does hold a lot of weight at shelters. And in general public as well. So you just want to make sure too, that you are advocating in the right way. Because the way you speak about these types of issues as well is also going to hold weight with the rest of the staff as well. So it's something that you do want to be mindful of when you are working at a shelter.
And I think that's a really awesome point, is that even if we're not involved in the leadership itself per se of the shelter that we're in, we do have a responsibility with our team, and we can lead them in teaching them what bias means, what implicit bias is, and how to avoid microaggressions, even when just talking to each other, but when talking to the public about the shelter, when talking about the shelter pets that they see, or they see the pets coming in. There have been times where we've had pets come in for spay neuter that are a matted, clumped up mess with poop and long nails and everything, but there is somebody behind them that loves them. It might not look that way when this pet is removed from that person. And that's one of the major things that I think shelter veterinarians do need to unlearn, is that question, or that presentation of this pet is in dire need. This person doesn't deserve this pet. But And then once the veterinarian is past that, just like you're saying, Rachel, to relay that to the techs when the vets come or the pets come in, seeing these pets seeing these animals, the techs will ask, like, how can we send this pet home? How can we return these pets, these people? And definitely I found it incumbent upon myself to remind them that there's a story behind everybody. Yes. And the human animal bond knows no bounds, no income level, and they might just not understand how awful mats are, just don't understand what's happening behind there. And they're here now, and we get to help them. And rather than bringing this pet into the shelter system and removing it from its home, it's always better to keep that pet in their home with the person that does love them and loves them enough to get them in front of us eventually.
Jesse, along those lines, I think it's what you were talking about with the messaging component, how often, we'll have cases that are where the animal, like you mentioned, has now been turned around, and how we message our work to others is really important from a marketing standpoint too, as an organization. Like, how are we portraying ourselves as, are we having a savior type complex where we have now saved this animal from this dire, situation, and now we are reaping the funds and the fundraising and everything from having saved this animal? Is it being framed in a way, the story being framed in a way that that really speaks to that underlying bias and those assumptions that we've falsely created, and thinking about the ways that we position ourselves. That what you just described had me think about that, and I know both of you have experience with this in your own practice worlds.
Yeah, no, I mean, I have a case right now that I'm going to be doing surgery on this Friday that really speaks to this. I mean, if from the outside looking in, you would be like, oh, wait a second, what happened here? So this dog has this pretty nice sized mass on its abdomen. And, outside, if I just saw this, I'd be like, oh, wow, like that's very painful. It's infected. Like this has been here for a long time. What's going on? Initially, I know definitely when I first graduated, I probably would be like, wait, we need to take this animal, like we're taught like this is probably considered animal abuse, like in some type of way. But then, now knowing and seeing what I have seen and being in community medicine and community outreach so much more, that is not the case whatsoever. And, after talking with these owners, like, I'm so glad they reached out to this program that we have in Chicago. It's the CRIS Coalition. That they were finally able to find us. And that is one of the biggest things they are constantly telling us is that, thank you so much for helping us. We've been at multiple veterinarians, and especially right now during a pandemic, we don't know anyone's financial situation whatsoever. It started off very small, and they told us this was very small. We went to the vet. They said we can monitor it for right now, but most likely going to have to do surgery. So they started saving up for the surgery. Then when they finally had the money to go get the surgery, when they went to the vet again, oh, it has now progressed. This is no longer this cost. It's going to be a couple more $1,000s or, some type of money. And I understand, but at the same time, like these people are trying, like they're doing everything they can to treat their pet, to treat their animal. And, the last thing they want to do is really release their dog or surrender their dog. That is not what they want, but they were willing to do that if that was what the pet needed. And so I think that's what we really all have to think about, especially when we're thinking about people who are surrendering their animals. We tend to put a lot of judgment, I feel like, on those people, like, oh, you're moving. How could you do that? Like, these animals are for life. But you have to think about everyone's situation and what's happening in these situations and these families outside of just this. Maybe I have to move because of X, Y, and Z, and this is the only place that I can afford. And unfortunately, they're even just pit bull, say it's a pit bull. They don't accept pit bulls. They said they were dog friendly. I don't know what else I can do. I have to leave. This is my last option. So these are the types of things you have to think about. And I mean, I think this is really nice, is ways that shelters can start helping again. And what we're seeing a lot more of is that we are having more of like, we want to keep the animal in the home. So we're going to create programs like maybe we can help foster for like a couple months, and we will do that. And then when you figure out your living situation, we can give back home. And I mean, I don't know if you guys have seen different experiences or had different experiences like with that, but I know that's something that we can move towards. And that's what I'm hoping a lot more shelters are going to start doing as well.
And I love, I think you hit home when you were saying the community outreach part of this to fast track the unlearning and unpack all of that super quickly. I believe home visits and community outreach, and even not necessarily going into their homes, but for me personally, it was doing home visits, but at least seeing these pets in front of their owners really helps drive home the idea that you have to ask these questions, Rachel, just what you were asking, or the statements you were saying about moving and being able to keep your pets. There's nothing more humanizing than meeting somebody right where they're at, right? Mm-hmm. And seeing this in person. And I do encourage all the vet students to find ways to do this, to get in front of owners with their pets, and just meeting them, creating a relationship with the owners, the clients, and being present with them I would like to think that I was open-minded and considerate before I started working community outreach, mm-hmm. but I don't believe I was. I am a completely different person now, because it reminds you to ask yourself these questions when any thought comes up. Are you thinking about the story behind all of this? I absolutely love it. And I totally agree that we're seeing a bunch of these community outreach efforts, or a number of these outreach efforts cropping up around the country. Many shelters are going into it. And what inspired me about this, because background, Rachel and I worked together at Paws Chicago, which is a very wealthy shelter, and they could afford to launch their community outreach program, mm-hmm. And where we could do home visits and things like that. But recently I was working for a municipal shelter, Animal Care League, that certainly could not afford anything along the lines of what Paws Chicago had. But they were able to create just one day a month where the pets were brought in front of a veterinarian and at least got their vaccines, got the basic preventives done, but also the vets were able to answer one or two questions or do a full physical, or brief physical, maybe 2 minutes, not 5, but at least give the owners an idea of what's going on with their pet, and just some simple husbandry tips, which really empowers them, really helps them believe in themselves and know that they're doing the right thing or the best that they can do for their pets. And with those, with all of those systems and opportunities cropping up, I feel like it's a great time to get involved as a veterinary student or even as a veterinarian. They're always looking for volunteers. And I think, Rachel, you bring up the best point, that it's so important to ask yourself those questions. And I don't think you can really understand how to ask yourself those questions until you witness the love that these people have for their pets.
Yeah.
I agree as well. And I guess I'm thinking right now in the back of my mind about some national programs that are really working towards that, which again, the veterinarians who are on the call likely know about it, but the veterinary students may not. So since our target audience is the vet students, I do want to mention like Human Animal Support Services, which is PAWS, is really looking to keeping, families together, keeping pets at home. Pets for Life, HSUS's Pets for Life is another program that's been doing this for a very long time. Align Care, which is through the University of Tennessee, and their program for pet health equity has really been looking as well at ways to think about incremental care. And I know we'll get more into that a little bit later on, but wanted just, I knew that Jen would be putting links into the chat for especially our vet students to be able to take a look and see that it's not. I mean, there are a lot of programs and opportunities now, and I think there are more and more opportunities for veterinary students to become engaged with their local municipal shelters and community clinics and volunteer some hours to actually experience what it's like to work in these types of situations. I know for me at Oakland, when I was at Oakland Animal Services for many years, we would have veterinary students come from UC Davis and shadow with us, and it was probably the most amazing experience of their lives. At least I was told. I mean, who knows if it really was, but I was told it was a pretty amazing experience to really really work with people. We would at that time go to unsheltered locations, so homeless like areas, and do various clinics there, and completely reframed their view of the human-animal bond. And I know Jesse and Rachel both spoke to that from their own experience already. So,
and I think it's important to, as veterinarians, as we're moving to become veterinarians, to look at the research on the human-animal bond and how much data we are gathering and how many papers are coming out showing not only the emotional benefits of the human-animal bond, but the mental and physical. And if we are saying that there are populations of owners who don't deserve to have animals, then we're also saying they don't deserve to benefit from these things. So it's along the same vein of saying, people in poverty don't deserve to have children or shouldn't have children. It's that same sort of mindset that's really, really damaging. I love, Jyothi, that you brought up Pets for Life. There's a statistic I'd like to throw out there and get some commentary on. Pets for Life does go out to these underserved communities, and they do a lot of survey data. And they found that 78% of owners encountered by Pets for Life have never contacted animal services for any reason. Why do you think this community is so hesitant to reach out for help?
Yeah, I mean, I think it really comes down to mistrust. And hopefully it's getting better now, but I know, at least in my experience talking with some of the community members that I've come in contact with in Chicago, and they're basically in a veterinary desert. So we were the only ones who were coming to them at all. And, their first instinct isn't to call animal care and control. It's not to even like to look for their pet or anything. And I mean, it's all mistrust. I mean, even for us to come to them, we had to build a trust with that community because of the years and years of damaging like commentary. I mean, even like you get fines. If you come to like say animal care and control, they're doing their job, and that is what they're supposed to be doing. But so they see your animal out or something, or every time it used to get loose, you would get fined for it. And I mean, that's damaging enough for a pet owner who can afford it. And I mean, for someone who potentially cannot afford something like that, that's just like, well, I can't go look there because I can't afford to get my pet out if he is there now, or something like that. And I mean, I think that's like the biggest thing I can really think of is that they just didn't trust them. They didn't trust the system. And that's the animal care system, but I mean, we could even go as far as most people don't trust, the policing system right now in our country. So if you can't trust that, how are you going to trust someone who's basically policing animals as well? So it's hard to say, but that's where I think the reason why we don't go, or a lot of people don't go to animal care and control first might be that reason.
And I absolutely agree too, Rachel, of course. And it boils down to, it seems, the penalties and the fines. It's all punishment, really, when these people, when their pets get out, in order to get them back, yes, they have to pay those fines. They get these court-mandated spay neuter requests or court-mandated visits to the veterinary office and things, obviously they can't afford, but then they're also facing this extreme judgment. These court mandates are coming through, and they're being judged straight to their face, that it's being told that they're not providing well for their pets when they're truly doing their best. And a lot of it does, it definitely is a trigger. I know that in our community outreach, a lot of thought went to how we phrase who we are. So when we went into Englewood and Back of the Yards, our cars, we didn't want our cars to say rescue, because rescue was a trigger word. We're not rescuing anybody. We are there to help the pets stay healthy in their homes with their families. And I think that's where a lot of the animal care control issues come in, because they're there as a rescue, and they do wind up villainizing and demonizing the places where these pets have come from, and they instill these enforcements and fines and penalties, which then turn around onto the public, and kind of just what you're touching on, Rachel, is the public views these neighborhoods and these people as less than, and as unable to provide. Sorry, words are hard. Provide for their pets.
Well, it's funny you say words are hard, because it's exactly true, right? Like, that's the language that you're talking about when we utilize these words. And what you're also speaking to sort of indirectly is rescuing animals in shelters, and the idea of supply demand, source shelters, destination shelters, and how to reframe some of that conversation. And like, is the source shelter, so for those of you again who are veterinary students who are maybe not as familiar with the terminology, the shelter that a organization is taking animals from and then moving to a destination shelter, which is where they may end up being adopted, is that source shelter being portrayed as a shelter needing rescuing, needing assistance, impoverished, not able to care for the animals in their location. The people may be portrayed that way as well. So what does it look like to have new relationships, and those relationships being marketed in a different way? And that's, I think, has been important for both you and Jesse and Rachel in the work that you've done, because you've worked with both source and destination organizations. So put that out there as well.
Can we speak on how shelter practices such as transport are playing into these biases for their gain as well? So topics such as transport, fundraising for certain communities, right? We're leveraging that for our own gain. Could we talk a little bit about that as well? More in depth.
Yeah, sure. I mean, definitely goes to that marketing component that I was mentioning from a fundraising standpoint. It's, even when Rachel was talking about those individual cases where you can actually end up fundraising quite a lot for an individual animal that you've pulled from another organization, and now the funds are going to the destination shelter, which isn't benefiting the source shelter or helping that community, which may be under-resourced and likely is, which is why those animals were pulled in the first place. That's one component. I think the other, the actual structures of sheltering, I think, is another deeper issue. Like, it's not even, it's not just fundraising. It's just even the way that you think about yourself working in each of these organizations, and that feeling when you're in a shelter where all the really highly adoptable animals end up leaving, and then you have whatever is left, that feeling of maybe not being able to care for those animals effectively, or that you don't have the resources to care for them, is really frustrating from a veterinarian standpoint. I know, because I've been in that position where I've worked with shelters that are under-resourced, and you want to do the best you can with the limited resources you have. And it's frustrating then to have another organization able to do that and not necessarily able to help that, us in that situation. And I do think, again, that even this conversation that we're having right now is being reframed with groups like HAAS, like Pets for Life, and others who are really saying, well, what is it we can do to shift that balance?
Yeah, and I even think too, like you were saying, like definitely the marketing, I've seen that being done. One thing, the one dog we're helping, we're actually giving back to the owner. That's not the same, but no, I think a really big thing, aside from the marketing, where the fundraising is coming back to the new shelter, the transfers, is that when we are grabbing from these source shelters, we also are probably picking their most adaptable animals. And if you have the choice like that, it is what happens a lot of the times. Especially when you look at some of the shelters, specifically, so I'm in the city of Chicago. So a lot of the times we would see we're picking all the small fluffy dogs, right? Because everybody wants a small fluffy dog. So if we take it from this shelter, they're most likely going to get adopted very quickly here. We've helped, we feel good, but we also get the adoption, fee, and everything like that. Whereas now the source shelter, that's probably an adoptable animal, just they're probably not going to stay that long there either. But we do overlook these larger breed dogs, or, again, pit bulls, unfortunately, I love them, but everyone doesn't. They're not everyone's cup of tea, and they get left, they get stuck in places. And, we want to see us picking more of these. And if we can, we will. But at the same time, they are harder to place. They are harder. And that's why we are picking the most adaptable. And then we have to think about that is, what are we doing for these source shelters when we do pick these? Are we really helping them by taking the adoptable animals? And then they're still have the harder to place animals, and they just have more harder to place animals, and then they're not getting adoption fee money. Because a lot of times at a lot of places that I saw in central Illinois, is that they would just be like, oh, you've been here for X amount of days, like they are free. We will waive their adoption fee. So now they spend a lot of resources on this animal, and they won't be receiving anything back whatsoever. And although that's great, that's what we wish we can see too, but it is something to think about when we are doing all these transfers from clinics or from shelters back and forth and things like that.
And I totally 100% on the same page. The one thing I'm gonna say, and that this is such a major topic, of course, obviously, but there is also, and I think I can say this and have you guys agree that we're not necessarily talking about the smaller shelters that are trying to do their best to pull the pets and to share the load, but the smaller shelters can still be select because they might not be able to afford to carry the heavier medical loads. So I just wanted to make sure that the air was clear for everybody listening, that we're not trying to say that that necessarily, and I know this kind of goes against what we're saying, but it's not bad to select. Some smaller shelters might be helping some way by relieving the load on municipal shelters, even if they can only take the more adoptable pets and they can't take the less adoptable or the heavier medical ones, because not every shelter is lucky enough to have full-time vet staff or the means to provide for medical. But I want to make sure.
Yeah, great point.
And that's really important, because again, that speaks to language and how we frame that, and how they market that relationship really makes a difference. And again, from a veterinary student standpoint, when you're looking at working for an organization, think and take a look at how they market their relationships with their partners. You know, what does it look like for a shelter that is choosing, and what sort of language are they using? And is that the type of organization that you want to be associated with and that you feel upholds your values and what, you know, the type of work that you want to be doing in the community?
And if I may piggyback on that, to also pay attention to what they're advertising to the community to adopt, or who they're attracting to adopt from them, looking at their truly like their advertisements in the airports or on the the streets and things like that. It's something that I was definitely blind to really when I started into the professional world, and definitely recently became much more aware of the fact that there are definitely ways that the biases that are portrayed just through the advertisement of the shelter alone to the public, and what pets they have on there. They have the pitties, or they just have the really cute small white fluffies, anything like that.
Yep, and along those lines, how are BIPOC people of portrayed in images? Is it always like receiving something, like receiving food or donations, or are they the ones that are shown as veterinarians and technicians and
or even just doctors?
As a doctor. Yeah,
because a lot of times you notice like the BIPOC community is not really shown as like, oh, look at this new home with this, you know, it is always like, oh, we helped, we're taking from this family or something like that. And it is something that you want to be cognizant of because of the biases that are so evident. Especially, I mean, I do think even especially in the animal world, it's just a big thing. I mean, for instance, I mean, you talked about even showing as veterinarians, like representation in every field matters, but we know like representation in the veterinary field is very low for BIPOC people, community. So it was very, you know, humbling. And, you know, when I first went into with the Paws for Life, so Paws Chicago, like Pets for Life, they basically really like copied the motto of Pets for Life to help create this big program on the south side of Chicago in Inglewood and back of the yards. And so we would be in the community, what, like I mentioned, was the veterinary desert. And we now have a standing small little clinic in the bottom of a church, in the basement of a church, but it works. It's perfect for what we need. And, you know, when I first started meeting the community members, I mean, they had never seen a Black veterinarian before. And I mean, to be honest, I hadn't seen a Black veterinarian until I was like 18 or 19, you know? So like, it's really incredible because they would just straight up tell me, they're just like, wow, like, this is incredible. Like, you're the doctor, like, I feel better, you know? And so it's important. Like, as much as we want to harp and say like representation is important, it is. And it is, there's nothing more you can do. But if you see someone who, as a veterinarian, you're going to meet families after families after families, right? If you're, say you're in GP, or even if you go and work in a shelter, you'll see families walking in, looking at the pets. If you notice and hear over here, and they're talking about like, oh, I want to be a veterinarian someday or something like that, talk to them, tell them they can do it, and, you know, put them in touch with someone who can help them do it that way, because that's going to be how it happens. A lot of underrepresented communities don't have a veterinarian, sometimes even within a couple miles of them. So it doesn't seem like an attainable field, and they need anyone who will be that mentor for them to keep pushing them along. And so if we're putting barriers, back to what we were talking about, if we're putting barriers on adoption processes and they're not even being able to get a pet, how are you going to foster that drive to become a part of the medical field or a part of the animal welfare field if they can't even, you know, start off small, where we all start with, I love dogs and cats, right? That's where we all started somewhere. So it's just something to think about.
And actually, it's probably one of the most important things to think about when you think about access to veterinary care and some of those underlying considerations, right? That we don't have veterinarians that are representative of the populations. And how can we, if exactly for what you described, reasons and other reasons as well. And I'm realizing we only have 10 minutes to actually touch on access to veterinary care, which seems.
I was just about to try and lead into that, but yes, we should end on an optimistic note of where shelter medicine is heading. We've definitely touched on some programs, but we would love to hear more about the field of access to care, incremental care, spectrum of care, those type of things to end on. And like I said, we will send out a post-event survey, so please fill it out and let us know how you enjoyed this panel and where you would like to go these conversations to go in the future.
So with access to veterinary care, again, because I'm not exactly sure what the audience knows, for veterinary students who are listening, we can think about it in different compartments, right? There's different barriers to people being able to access care. So there's financial barriers, geographic, like transportation, being able to get your pet to the vet, or even having veterinarians in the area, as Rachel was mentioning, right? Or being rural, where it's incredibly hard to get vets. But there are veterinary deserts everywhere. Again, both Jesse and Rachel work in one. And so there's the geographic barriers, and then there's knowledge and cultural barriers, language, and being the DEI components that we've been discussing that also play a major role in access to veterinary care. And some of the solutions are those that you've likely heard about in veterinary school, hopefully, things like incremental care and spectrum of care. Incremental care being, if you are in a practice, example would be a URI in a cat, right? Where my option, if I go to private practice, could be to get full blood work, chest rads, maybe even a CT, because I know that some of them, like in a study that I recently did, have, a lot of ear issues related to it, and you want to get a nasal planum, right? So like you have this full list of things that could happen. Or you could say, okay, well, doxycycline might be the treatment of choice, because we assume that vast majority of them will resolve if we reduce stress. Let's find out what were the causes and then go through an incremental care approach. And that is just an example of, as veterinary students, when you're looking at practices and when you're learning in your veterinary schools, if you're being taught only that, so I'm going to put it in quotes, gold standard of doing absolutely every single test that's possible, or if it's practical so that people can actually afford to care for their pets in a way that actually is based on science as well, right? And it's so that's just oh, thank you, Jen, for defining URI for me. And so there's many different ways to think about it. I want to make sure that since we're short on time, Jesse, that you have a chance to offer your thoughts, and Rachel as well.
Yeah, thank you. Yeah, and that's exactly it. And you guys both said the buzzword of the resource deserts for access to veterinary care, and that's exactly what it is. And it's
Oh no.
No.
And he was saying something that was absolutely amazing.
I know.
So
Good, at least in a very thoughtful pose.
Rachel, why don't you step in there?
Wait, Jesse, are you back?
Sorry. I'm back. I'm so
okay,
sorry.
Go. You could go again.
Terrible. Oh, bad timing. What was I saying? Anyway, but yes, the hot button issue, or hot button topic of the resource deserts, and now it's gone. And so relating back to the cause, or our initial question of racism and systemic racism, how that's definitely shaped these resource deserts, leading to a lack of complete veterinary care in the area. And what we were kind of like, and obviously this isn't just like Jyothi was saying, my major topic that you can go into for hours on end. But in order to, or I guess the basis of access to care, or the driving factor, is that we want to do this in a sustainable way. We want to find the most sustainable way to reach out to these communities, establish care in permanent care. So that's why the establishment of our small clinic in the basement of a church in the heart of Inglewood was still massive, because it's something permanent, something that people living in the resource deserts, they're not used to seeing. They're used to seeing people looking like me, cis white people, coming in temporarily to provide some sort of care and then leaving. So to have something permanent there, it requires everything that Jyothi was touching on. I believe that we're going to find that we're going to interplay free care and temporary spay-neuter support, free vaccinations, with aligned care and other types of cost-effective management, and then leading to the further establishment of the permanent facilities. But because it is based in systemic racism, and because that is so deeply rooted, pretty much from our origins, it's going to take so much time to really establish that permanent solution. And I think that's why it's amazing it's growing and catching the friction that it is.
Yeah, and I mean, going off of that, I mean, I believe that's what a lot of shelters are moving towards, is we're figuring out, like, you know, it's better to keep animals in their home. That's the ultimate goal. We don't want them to come and stay with us. If we can find a way to keep them in their home, that's what we should be doing. So that's why the access to care is so important. And as veterinary students, I mean, when you start practicing, I mean, you know, just don't be scared. Like, you know what you're doing. You know, it's scary when you first get out there, but we might not be able to do all the tests. We might not be able to do all the diagnostics, but we can figure out a way, like, hey, if I do have this blood work, though, what might it tell me? Is it going to change my treatment plan? If it's not, do I really need it? And those are the types of things that you think, like, maybe not blood work, or maybe this diagnostic test. And that's kind of what Jyothi was talking about with, you know, URI. Like, should we maybe see if doxy is going to work? And if it doesn't, then we can move towards something else. And so that's how, I mean, even now, when I'm working up a lot of cases, and this is how kind of shelter medicine is too. We don't always have the most resources to do all these tests. We can't always, we have to be very strategic with how we spend our resources. And so that's something that we want to make sure we're doing. And like, one of the biggest things, aside from the medicine, is that you can't be judgmental. So you have to throw that away. You cannot, because I mean, they'll know right away. Like, you can tell, even if you're putting a smiling face on, oh no, did you just say like, even say in private practice, did you just call my pet fat? That will throw people the wrong way, right? So you have to be careful with how you're interacting as well. And you just have to throw away your judgment, because we can't be judgy about this. They came to you for a reason. If they didn't care about their pet, they would not have come to you. And so they now have the opportunity to come and say, you know, like, oh, like, you're providing veterinary care, here's my pet. And like, so at that point, you locate, you educate, and you're able to work up these problems, and, you know, you're going to build a very fast relationship. And I think one of the biggest things I also learned while doing the community outreach, and, you know, is like, word of mouth is what really grew that program. When we started helping, we helped one family, and they told their friends. Like, it's now becoming to the point where you're hearing, like, I'm no longer waiting because my dog is itchy. Like, I can go and see what's happening at the church on this day. And I think that's the beautiful thing about it all, is that that's what's going to change everything, because they're no longer, we always say, like, oh, if they came in a week sooner, right? Well, now we're seeing them a week earlier. Now we're seeing them, you know, 2 weeks earlier. And that's the big thing. And that's like the really important thing about access to care, because small issues become big issues, and we all know that. So you just have to like I said, just throw away that judgment. It's just gone. You're seeing the pet as you're seeing it, and you're just working on what you can do. And that's the best we can do. So that's my take.
100%. And can I just piggyback on that? Because that's yes, that's 1000% yes. And that's what I learned to do is when you're a practitioner in an accessible care situation is with the best way to do it without judgment is to think and act and address these owners as your clients, as if they are paying for this service. They are still a paying client. Everybody is treated the same at the same level. And the only thing that changes is in your head, in your plan, just like Rachel was saying, you don't throw out all the things that the CTs and all the things that you can't do and that you know are beyond the scope of this practice. And you put out and present to the table, on the table to the owner, what you are going to do because of this, and that's it. And that's what you're going to do for them. And this is how you're going to help them. And yeah, you hit the nail on the head, and that's awesome. No judgment.
I agree. That's great. And, do the work yourself. Like, unlearn, think about your origins, think about where your ideas and thoughts come from, read, find out about systemic racism and all these other ideas. So.
There should have been a reading list plopped in the chat somewhere too.
Did she just put it by any chance or not?
I haven't been watching it.
Okay, I think Jen is about to put a reading list perhaps, so we'll see.
Thank you all so much. This was a wonderful conversation. I knew we would not have enough time to touch on anything. I will say I believe I'm the most recent graduate of everyone. I'm 2018. And these were conversations that we were not having in vet school, and we had a shelter medicine department there. So this alone makes me really optimistic, that we all as professionals are having this conversation, and that the students reached out to us to have these conversations as well. So I'm going to plug our post-event survey one last time, because we would love to hear from you and love to hear what topics you'd like us to dive deeper on. What you would like us to focus on. I think, like I said, we were all surprised on the interest for this event, so we would definitely be open to hosting more. So thank you, everyone. Thank you to our panelists. Thank you to MCVMA and ASV. Thank you to Voice, and thank you to Washington State for hosting us.
Thank you.
Yeah, thank you, guys.